Good evening, everybody. This is Betsy Wurzel, host of Chatting with Betsy on Passionate World Talk Radio. Jeannie White is the producer, and it is Thursday, March 26th. I have a very special guest with me tonight. I have known my guest for, we were trying to figure it out, 2.5, 3 years. I met my friend Colleen from doing a video. Colleen contacted me, and the rest is history. We are like sisters. We are so much alike in how we think, and Colleen is administrator, and she started it, and she's a founder of Alzheimer's Dementia Support and Education Hub, which is private for caregivers. I suggest if you are a caregiver, you join that support group. And Colleen also has Alzheimer's Dementia Support Education Hub, which is public if you want to be educated on Alzheimer's and other dementias. And I am also administrator at both of those groups. And Colleen is a member of my group, Kick Alzheimer's Ass Movement. And we support each other and what we both do. I want to welcome you, Colleen Fisher. Yay!
Thank you so much, Betsy. It's good to be on.
I'm so happy to have you on. And I also want to say that Colleen is a caregiver to her mom and does it all by herself with very little help. And I really admire you, Colleen, because you are a woman of great strength and an advocate for your mom and all that you do in both of your groups. I just love you to pieces, and I think you are super amazing.
Well, thank you very much, Betsy. And actually, I've gotten quite fortunate in these last few months that I do have, a friend now who is here a lot and helps me out quite a bit. So I'm not as alone as I was for about the first 2.5 years, thank goodness. But, yeah, I really admire you, too. I mean, you've made a lot of great strides in the dementia community in these last 4 years that I've been following you and Matt's story. So I think you're kind of like a leader and an inspiration to us all.
Oh, thank you. And I'm glad you have help. I really am. And I wanted to know, Colleen, what's on your mind tonight? What would you like to discuss?
Well, it seems to be like the hottest topic going around is the COVID-19 virus. And
right.
So, I think, it's kind of important to talk about what this means for, like nursing homes, what it means for people trying to visit their loved ones in nursing homes, the impact that it has on, in-home caregivers and the loved ones that they're taking care of, and, like what it means with the panic mode and supplies dwindling away and that kind of thing.
Yes, it must be, I can only imagine, very difficult for the caregivers who cannot see their loved ones because, as you know, and anyone who has any loved one with any type of dementia knows, things change rapidly. And the changes in their loved ones when they can see them again, I'm sure, are going to be, increased. And for someone like you who has a loved one at home, you have to be super careful of who you let in your house and, what you to do about, like extra cautious of cleaning and who you let in. And it must be, do you find it more difficult, Colleen?
I think, quite honestly, I think for some caregivers, they're going to find it a bit more difficult. Some had jobs they would work. It gave them a chance to get away from their loved ones. But for me, personally, I quit working in order to be able to stay at home and take care of my mom because the first, 2.5 years, it was just me. And so for me, it's pretty much life is normal. I mean, I've had 3 years to adjust to not being able to come and go as I please. I've had 3 years to adjust to the loneliness and the depression and the feelings of being forgotten. And I've had all those, I've already experienced all those ups and downs, the inability to work and the loss of, like freedom and things like that. So I think it's going to be a lot easier for me to comply with, the guidelines and the recommendations and staying at home than it is for, folks who don't do this that are just now starting to get a taste of what life has been like for the last 3 years for someone like me. So I've already had a lot more time to come to grips with it and come to terms with it and finally accept it.
Exactly. I mean, I worked outside the home while taking care of Matt, but still I had experienced the isolation of friends, of not being, invited to places, not being able to, go out as I would like, and being shunned. And I think caregivers, just like ourselves, can do isolation standing on their head because we're used to being, unfortunately, abandoned. And now people who are so-called, they're not caregivers. They're getting a taste of isolation of what a caregiver goes through. And maybe now, after this is over, people will be more compassionate, I hope, more empathetic to a caregiver. And my heart goes out to all my caregiver friends, whether they have a loved one at home and they can't take their loved one out, must be very difficult. And for those who can't see their loved ones, my heart breaks for them because I really don't know how I would have handled that. I think I would have snapped. If I couldn't have been with Matt in his last days of life, I think I would have lost it. And I'm not ashamed to say that because I think it would have been the truth.
Oh, for real, I think I would feel the same way if it was, my mom and end of life. But, I think 24-hour stay-at-home caregivers, we're the epitome of isolation and social distancing. We're the essence of only leaving home for essentials because a lot of the times the only way that we can leave home, especially without taking our loved one with us, is if we have to make special arrangements to have somebody sit with them so we can go.
Very true. I know. I mean, if it wasn't for Josh, my son, I would not have been able to work, and I would not have been able to go to the grocery store. And, yes, you have to just, go to where you have to go when you are a caregiver and come right back. There is no meandering around unless you have respite or you have someone who's going to stay with your loved one for that certain amount of time.
Mm-hmm.
And people don't understand that when you're a caregiver and you're isolated, that even going to the grocery store is like a mini vacation because you get to go out and just, take a breath. Are you focusing more on self-care at this time? Are you doing anything different for your mom during this time also?
We're not really doing too much any different. I mean, we basically the only time we left home is, if we were going to go to the gas station, put gas in the car, get a cappuccino, or she wanted a soda, or run to the grocery store to get groceries, or that kind of thing. So we're basically already used to only leaving for essentials. As far as self-care goes, I haven't even started to focus on self-care yet. I'm on day 5 of not having left the house. I think I went down to the mailbox one time in the last 5 days. And I think, all the sleepless nights and the worrying and stuff like that, it's kind of caught up to me and hit me like a ton of bricks because I've just been so tired. I will go to bed, sleep for 4 or 5 hours, wake up, end up going back to sleep, and then Mom gets up and I give her her morning meds, her day meds, her breakfast, that kind of thing, and then we both end up taking a nap. So I've just been doing a lot of sleeping. A lot of sleeping.
Yes, do it. Sleep and rest as much as you can. And I tell, caregivers, and you've heard me, self-care, and I know it's hard. I know it's very difficult to do self-care, but, make it a priority. Rest when you can, and just do what you can, because to survive this journey and to enjoy life after caregiving, to be healthy, it's a must. It's essential. And I'm very fortunate, and I thank God that I made it through the other side somewhat healthy, and I just have a couple of issues, and they're not really, major, but I just, you can't do self-care when your loved one is so critical and they need you, and I realize that. I know that. And, caregivers put themselves on the back burner all the time, and especially as women. As women, and I'm sure men do this too, but I think mostly women, that's ingrained in us. Put others first. And sometimes as a caregiver, you have to say, you know what? It's not being selfish. It's loving yourself to take care of yourself. And that's the advice that I have for you, Colleen, and and others. Are you able to take your mom to doctor's appointments? Because I know here in New Jersey, I was supposed to go to my lung doctor tomorrow, and he's closed, and a lot of doctor's offices are now closed.
Yeah, no, my mom was supposed to have a CAT scan done on her chest and on her stomach because her appetite was pretty poor for a while there, but it's actually gotten better. But she had a couple of little nodules or polyps on her lungs, and she was due for a 6-month checkup. So with her diminishing appetite and needing the CAT scan done on her chest anyways, they were just going to check, her whole upper part all at once. And I was supposed to call and make the appointment a couple of days before the COVID-19 outbreak really started hitting the news. And I had ended up calling and speaking with her doctor's nurse and seeing if that was something that was, essential that had to be done, or if this was, something that could be put off for a while. And they had said that, at that point they had said that they preferred that I not even bring her into the clinic right now. So whether or not they're still open or closed, I don't know, but they are not really wanting to have too many people coming into the clinic. I mean, yes. My county right now have just updated their site, and we've just gotten our 8th confirmed COVID-19 case in Rock County.
Wow. And you
and
live in
the biggest part of
Wisconsin.
That people I live in Wisconsin, and I think the biggest problem is I think there's a difference between taking something like this seriously, especially for our at-risk and our vulnerable, and going into hypersensitive panic mode. Now, I personally never went into panic mode. I mean, when I went to the stores and I went and did my grocery shopping and got some essentials and that kind of thing, I shopped just like I normally would. I didn't buy 15 packages of meat and 10 packages of toilet paper and that kind of thing. I shopped like I would normally shop, but I am taking it serious enough to we are taking it serious enough at my house to start taking extra precautions when we do leave, because we do have vulnerable people in my home. So when we leave, when either myself or my friend leaves, because we're not letting my mom leave the house, period, until all this is over with. But when we do leave, we leave with rubber latex gloves on. So any surface that we touch, we take gloves off, throw them away, sanitize our hands. And wearing the face masks so that when we're out and about in public and we're coming in contact with people, we're not bringing something, back home with us.
Yes, that's very good precautions. I live in New Jersey, and it was just declared a major disaster area. There was a nursing home. Oh, there is a nursing home in my township. I live in Island, which is part of Woodbridge Township, which consists of several towns. And the nursing home is located in Woodbridge, New Jersey. It's been on the news, so it's no secret. And they closed it, and they moved the rest of the residents to a facility up in Whippany. I think the last time I heard 24 confirmed cases, and that also included, I think, 5 staff members. There was 1 death reported from that facility. There are, I forgot the number, 40 or 44 cases confirmed today. And they're making makeshift hospitals all over the place and calling for doctors and nurses that are in retirement to come out of retirement, and they want the student nurses and the interns to go to these hospitals and give them pay them or help them with their schooling, because there's such a shortage. In New York, they are sharing ventilators. And here in New Jersey, where people are very rude and abrupt and in a rush, I had trouble finding food last week. And now they are rationing meat, water, toilet paper, and paper towels. Are they rationing where you live?
Yes, they are. A lot of our stores are beginning to put limits on the amount of each type of product that you can take, your Lysol, disinfectant, milk, eggs, meat, bread. I mean, I know when I went grocery shopping, I was able to find some chicken. I was able to find drumsticks. I was able to find breasts. I was able to find chicken thighs, but I wasn't able to find a whole chicken. A lot of our toilet paper shelves were empty, water shelves were empty. A couple of times I went, I was actually lucky enough to find a case of water. But what we're doing now is, my mom, we don't get her income until the 3rd of the month. So basically what we've been doing is switching, we've hung on to 4 of our empty water bottles and filling them up from the tap, and then just switching them out, and then we always have a cold bottle of water, and we don't have to try to rush to the store to get it, or something like that.
Yes, I was fortunate to have gotten a water, so I'm good. Before, maybe a week or 2 ago, they were letting you have 2, a 24-pack or 2 bottles of water, and now it's 1, and only 1 case each per person of paper towels, disinfectant, 1 or 2 packages per person of meat. I was able to find a whole chicken yesterday. I was like, yay, because when I went to one grocery store last week, it was, I never saw anything like it. Gone. The meat was gone. And I brought catfish yesterday, but in the store, all their seafood, used to be out in the case, was now prepackaged. It was wrapped up. Their hot foods is no more. Their deli department, where they have the coleslaw potato salad, or
we stopped doing that too. Yeah, we stopped doing that too. There's no hot food. No, no walking into a gas station and getting a cup of coffee or a cup of cappuccino or something like that. No deli.
Yeah. Well, I don't really have that problem here. We have Dunkin' Donuts here, and you are able to go in, but you have to stand back. And yesterday, I have to say this because it's kind of funny. Yesterday, I went to the bagel store because they have half price on Wednesdays, and I usually can't go because I'm working. But I went, and I didn't see the sign to stand back. And so the lady goes, "Don't you see the sign?" And I said, "No, I'm oblivious. I'm just used to going up to the counter." I said, "Oh, I'm sorry." So you had to stand back and give your order. And it's just takeout only here. Is that how it is in Wisconsin?
Well, all of our the dining areas are all closed down. We can still do like a curbside pickup or a drive-through, but you can't go into an establishment and sit down and have dinner or anything like that. And we can still do delivery, and normally it's like with special instructions to leave the food at the door.
Right. Yeah, it's really bizarre. Like, are your banks open inside? Because mine are closed.
No, the lobbies.
It's drive-through.
The lobbies aren't open. It's drive-through only. But
yeah.
luckily, my mom's Social Security check gets direct deposited into the payee account, so I don't have to worry about going to the bank for that one. But then she also gets a little bit of a spousal benefit, because when my stepfather passed away, he was military, so she gets a small like a widow's survivor's benefit from like military fund, and that we don't have a debit card for, so that we actually have to go to the bank and make a cash withdrawal. And now I'm going to have to learn the account number and stuff, because normally I walk in, they know me well enough that normally I walk into the bank and I tell them I want, like everything out, $5 to keep the account open, and they just look up her account and have me sign. But now I'm going to have to go through drive-through to do it.
Yeah, I think it was 2 weeks ago, and the bank was opened. Yeah, actually, it was March 18th, because March 17th was my last day of work, and not even a day. I was there for 20 or 30 minutes, and I went to the bank. It was opened, and the next day, the bank is closed on the inside, and I didn't know that they were closed on the inside. And they said, "Oh, yeah, just drive up only." So our Social Security is also direct deposit. I just have to go and withdraw whatever I need. And I thank God, really, that Josh and I have Social Security. And I have, like, Matt's pensions. But even with that, Josh doesn't have a job, and I'm not working. So I told Josh, I have to concentrate on paying the bills, and there's nothing extra. And his birthday's in July, and I said, whatever I saved up for you, because there is no money for extras. And, yeah, he understands. And he misses not working. And he was given a letter from his bus company that if the school districts don't pay for the busing that's already in their budget, then they will go out of business. And Josh has special needs, so it would be very hard for him to find another job. Very difficult. And I'm 62, so it will be difficult for me to find another job, because I would face age discrimination, even though they're not supposed to, but they do. So we're just, tightening up. But have you noticed that the food prices, paper products, have gone up ridiculously?
That's something I haven't really noticed around here. Now, I thought, that's something I haven't really noticed around here, is like a bunch of price gouging. And I know that there's like places where you can report price gouging too, but yeah, that's not something I haven't seen a whole lot around here. But I haven't really left the house very much since a lot of this started either. I think I've gone down to the, gas station maybe a handful of times, and I've only gone out shopping like once.
I've noticed they've gone
I've been pretty much sleeping around at home.
Yeah. I mean, I go out only when I have to, and I keep forgetting to put the latex gloves that I have from that in my car, my pocketbook. So now I took some gloves I have in my pocketbook that I'm going to use them when I go out. But I try not to touch the door handles. I use my jacket, and I have my antibacterial hand gel in the car I use before I even, start my car again. And I told Josh to make sure he washes his hands and do not put your hands by your face because it's a matter now of life and death.
Yes, and that's exactly why I won't allow my mom to leave the house until all of this is done, because she's got a fixation with rubbing her hands on her face, so she touches her face a lot. She rubs her face a lot, and with as much as her hands are on her face, I just would rather have her at home and have her safe. And I think it's causing a little bit more confusion with her, because she does like to get out of the house. She does like to go out and about, and I think it's kind of hard for her to understand, why we're able to leave and do the things that need to be done to keep the house going, but she has to stay. She has to stay at home.
Yes, it must be very difficult for loved ones who have, dementia, because they don't understand, even though, if you tell them what's going on and you don't want to panic them, or get them upset, and they may not understand, or of course you could tell them that 2 minutes later they are asking again because they don't remember. What are you doing to keep sane, Colleen?
I just tell her that right now it's not safe for her to be out in the general public, and that my reasons for keeping her at home is to keep her safe and to keep her healthy. And, I just explained to her, as many times as it takes. I explained to her that, my priority, yes, her feelings are a consideration. Her feelings are valid, but my priority is to keep her safe and to keep her healthy. And sometimes that priority trumps her, personal feelings. And she'll normally say, oh, I understand. Aren't you afraid of getting something? And I'm like, well, of course I'm afraid of getting something and bringing it home. But I also understand the necessary precautions I need to take when leaving the house. And like for you to wear the latex gloves on your hands and the face mask, that's something you won't be able to tolerate as well as I can. Plus I have Lysol. When I leave, I have Lysol disinfectant wipes that I can use to wipe down the steering wheel, the shifter, my car door handles. On the inside every couple of days, on the inside of my house every couple of days, I go around and I do the doorknobs and light switches and, surfaces that we touch frequently.
Yeah, they say to do that. In my stores, I haven't even been able to see any disinfectant wipes at all.
Yeah, I got lucky and actually got mine before the whole pandemic hit the news and people started panic shopping. So
yes, and I'm just like so. I guess I'm in shock that this virus was in one part of the world and now it's here and growing rapidly. And it wasn't in New Jersey, and then all of a sudden it is, and the numbers keep growing daily. And, you hear that nurses and doctors don't have enough equipment. They don't have enough masks. They're bleaching them and reusing them. And God bless all the healthcare workers and people who are on the front lines that deal with the public and really are at risk. I did read that certain companies are giving bonuses at this time to their workers.
I think
which
every
I think
person who is out on the front lines, whether it is a fast food worker keeping the drive-thru open so people have a place to eat, whether it's a janitor or a janitorial service or a cleaning service that's going into stores and cleaning up stores at the end of the night when they, like when they close, and the employees that are doing it, and, your cashiers at, gas stations, and your doctors, your nurses, your firefighters, police officers. I think every single one of them deserves hazard pay at this time.
Absolutely.
Going out there getting sick to make sure that the rest of us are supplied. So, honestly, after this, I don't want to hear one person even make one snide remark about how, a gas station employee or a fast food worker doesn't deserve to make $15 an hour when they can't do basic math. Well, I'm sorry, but we all have our areas where we have our strengths and our weaknesses. I worked fast food. My weakness was math. My strength is I do very, very well with reading and comprehension and the written language. So I think, it's all these essential workers that are keeping America going right now, that it's keeping the world going right now.
That's right. People should never, ever look down upon what someone does for a living, because at least they are trying and they're out there. And what difference does it make? My son is a bus aide. Josh found that job by himself without a job coach. And I'm very proud that he does his job. He's well liked. He's been there for 13 and a half years. I was not great at math. And back in the day when I was a teenager, you had to figure out to change yourself because it wasn't computerized. So that I had worked at McDonald's for 2 weeks. Boy, did they get me off that register fast. I was not good with giving out change. So they put me on their French fries, and I couldn't stand it. But every job is important. And I remember a teacher in grammar school saying, we can't all be doctors and scientists. You need your plumbers. You need your electricians. And every job is important. And I always treated people, everyone the same. I didn't care about what their job status was. It doesn't matter. When I worked at retail and I worked in a store, my manager said to me, "Betsy, you treat everyone the same." I said, "Yeah, because everyone is the same. And you don't know. A young child comes into the store and they may not buy something, but they might tell their mom, 'Oh, that lady was nice. Can you come in, buy something that I like?'" And I always told my other coworkers, don't judge people by what they wear, because someone could be pretending to have money, and people who have money dress regular. And you don't know if that person just is coming from the gym, getting their hair done. You don't know. So I've said treat everyone the same. And I've always done that. And when I worked as a nurse, I treated my patients, and when I worked at Woodbridge Civil and Mental Center, it's an institution for the severely handicapped, I treated them as if they were my family, because I would want someone to treat my loved one with respect and dignity. And that's what people deserve. And, I think your mother's a hoot, Colleen. I just love your mother. I think she's adorable. I just love seeing her videos. you know, people need to stop judging and criticizing and start loving up. You know, I love up on a caregiver. Love up on people who are less fortunate. You know what? With the turnaround of the events, it doesn't take much for someone to become homeless these days. And nobody wants to be homeless. No one chooses it. No one chooses to have a mental illness or a catastrophic medical illness that can make them go bankrupt. And
exactly.
I just, you know, I mean, you just don't know. And when people say to me, Colleen, oh my goodness, didn't that to make me jump through my skin? You know, oh, Alzheimer's is an old person's disease, or, oh, that's a normal part of aging, when we know it is not. And anyone can get any kind of dementia. You could be healthy as a horse, and yes, you can get dementia. I have seen it happen. You've seen it, Colleen. Young people
can get
dementia. Yes, exactly.
There's a couple of different genetic diseases where a child can experience dementia symptoms, and each condition, I remember the one is called Batten disease. The other one I haven't looked into very much, so I can't remember what it's called, but they are 100% fatal 100% of the time, just like with adult forms of dementia, young onset, Lewy body, vascular, but the one that happens to children is Batten disease. And symptoms can begin as early as 1 year of age, where, you know, they'll forget how to drink from a bottle, you know, basically regress until they pass away. And some children don't experience symptoms until they're, you know, five years old. And then they forget who mom and dad is, and they begin to regress backwards. So it's not just an old person's disease. It can happen at any time, at any age.
I can't even imagine that pain. Josh is at very, very high risk for early onset. And I really hope I don't see that. But I am taking my son, Josh is going to be 36 in July. And I talked about this before the virus even hit. And now the lawyers are closed, but I want to take him to get power of attorney of him for medical and financial so I can have a say, and I want him to do a living will where he puts his wishes, what he wants, what he doesn't want, and make it legal, because we're not guaranteed tomorrow or the next breath, and I think everyone should, you know, think about end of life, not to be morbid, but, you know, that's a part of life, and get your wishes known to your family and make it legal, especially now with this pandemic going on. You want to be able to say, here's my paper, here's what I want, here's what I don't want.
Yes. And I do think that's that's probably like one of the most frustrating parts about this, you know, whole COVID-19 pandemic is like people are worried about, oh, well, you know, now we have to stay home. We can't go to work. We can't come and go as we please. Well, that's just something that, you know, like, you know, caregivers, not only do we, in the beginning, do we have to discuss end-of-life things, but during a pandemic, we have to begin to think about those things too, because, you know, I have a 77-year-old mom. She not only has Alzheimer's, she has COPD. She also has heart disease. So that makes her an extreme risk of somebody who probably would not survive it if she got it. And now I'm stuck with, yes, we know the final results of what dementia is, and on one hand, you don't want to see them live through that final stage, but on the other hand, you don't want to let them go either when they still have so much quality of life left, like where, she can still feed herself. She can still get herself dressed. She can still put lotion on her own body. She can still help me fold laundry. She's mobile, She's still able to speak and laugh and joke and talk. And it's just, to me, it's just too early for her. So
Right.
It's not about letting nature take its course. If nature were taking its course, she would be passing away from complications due to the dementia and that some virus that's been brought and spread throughout the community.
Yes. And you have to be cautious. And, if Matt was at home, I would be very cautious. And I would be afraid of bringing it home to him because you don't know until you get the symptoms. And then they've already been exposed.
And even that's part of the problem is, a lot of people do not take it, they don't take it seriously. They think it's just a bad version of the flu. And the problem with COVID-19 is it's so highly contagious and so many people can be asymptomatic and they can be infected with it, never even experience a single symptom and still pass it on to other people. So you can have COVID-19, be asymptomatic, infect the other people, and never even know it because you yourself never got sick.
That's exactly right. Before my preschool closed, I was telling the kids, don't hug me. I love you. I know you love me, but don't hug me because Miss Betsy is at risk for getting it. And I didn't let them hug each other. And one parent got annoyed, but I don't care. She said, oh, no hugging? I said, no, they could carry it. They could be a carrier and then go home and infect you. And I can't take that chance. I'm 62 years old, and I am at risk. My age, and I have a lung issue. So that puts me at risk right there. So that's why I'm very cautious of staying away from people. I only go out when I have to, and just taking precautions as much as I can. And I've told Josh, make sure you wash your hands. I gave him antibacterial gel, and I told him it's no joke. This is serious stuff, and people need to stop being selfish and self-centered and take this seriously. People are so spoiled and entitled these days, especially a lot of young people, not all young people, but a lot, because that's how they were brought up, unfortunately. And, it's not about you. It's the person, I can't, go out and, well, I'll do it anyway, and, I'm too young. People young are getting this COVID-19. There's people that are young. There's a 5-year-old in New Jersey who was positive.
Even if you're not worried about yourself, at least take the time to think about your friends, your family, people in the community who are vulnerable, who are at risk. It's not if you're sick or old, stay home. It's have consideration for your fellow man.
Exactly. And my heart, yes, and my heart goes out to seniors who go to the senior centers, and that's their only way to socialize. And now they're isolated, and they said, depression and suicide is going to be on the rise because people are going to be very depressed.
The saddest thing to me is seeing the photos and the videos in a lot of our support groups, because you and I are both members of several different groups, and you're seeing photos and videos of people trying to visit their loved ones in the nursing home. They have dementia. There's one guy in one of the groups, I'm not going to mention him by name, but he does, videos between himself and his father. And there was a picture of him looking at his father through the window of the nursing home, and his dad just had the most dejected, sad look on his face, and it was really, really, really heartbreaking. You're seeing people standing outside their loved ones' windows, trying to communicate to them through, windows and not being able to visit, and you're having to have nurses do FaceTime and Skype chats. And, a lot of these people with dementia, they don't understand why their loved ones aren't coming around anymore. And then by the time this thing is all said and done and they're able to get back to see their loved ones, they might not ever be the same. They might not know who you are or, you know, why nobody's come around for so long. And, you know, you might find where they were able to walk and talk before, they might not be able to by the time you get back to them. And it's really sad. It's really sad to see.
Yes, it is. And because we're in both groups, yes, we see that, and we're also in other groups, and it is just heartbreaking, especially when you know that your loved one, especially if they're, you know, elderly and have other health issues, you don't know how long they have. And like I said, this disease can change day by day, Alzheimer's and the other dementia. You know, they lose their skills overnight sometimes. And you never know. It's so unpredictable. And it really must be difficult. And I know that here and in other places, if you're in the emergency room, your loved one can't even go back to the emergency room to be with them. You know, I mean, I told Josh, I said, Josh, if you go to the emergency room now, which I hope you don't, I can't go back there with you. They won't let me because of the virus. And, you know, it's something not to be taken lightly. I mean, I don't believe in, you know, causing mass hysteria, but this is a very serious illness, folks. And, you know, do your precautions. Take it seriously. Stay home. If people were to stay home, this would clear up probably a lot quicker. And if you think it's such a sacrifice to stay home, then you don't know what a sacrifice is, because in World War II, they were asked to be served overseas and be shot at and got killed. We're not sacrificing by staying home and sitting on the couch. There's plenty of things if you could do at home. You know, now's the time to spend time with your family. Get reconnected with family. Get reconnected with friends. There's always the phone, folks. There's FaceTime. You can get in touch with people, especially caregivers. And I want to say this, and I don't care if people get offended because, you know, Colleen, I tell it like it is. Call up a caregiver. Call them up and say, I know it's hard for you to get to the store. Can I get you anything? There's resources out there. If you cannot get to a store, contact your local township or whatever it's called where you live and see what senior citizen things they're offering. I know my township, we hear from the mayor every day. If you need help, you call the township office. You call the mayor's office, and they will guide you. Call your county office of aging for resources, and they can help you. There are resources. If you can't get to the store for your medicines, there are people that are delivering. There's volunteers that are helping people and going to the store for them. And I want to, you know, really stress that, because caregivers, as you know, Colleen, are the forgotten people along with their loved ones, even when times are good. And, you know, check up on your elderly neighbors. Check up on your caregiver friends. And let's be kind and love one another like we're supposed to. And, Colleen, I can't believe how fast time has gone. Do you have any words of wisdom?
Only in that I agree with you. Caregivers have already spent so much time when things weren't hard, feeling isolated and lonely and abandoned and forgotten, that now more than ever, they really need people. You know, it's very, very, very difficult for somebody who's been doing so much by themselves for so long to actually reach out and ask for help. It makes them feel uncomfortable. It makes them feel like a burden. It makes it feel like when people are giving them that help, it's out of obligation and not out of friendship. So I just say take the time, reach out, like you said, take the time, reach out to a caregiver, ask them if there's anything they need. Are they getting low on supplies? Do they need toilet paper? Do they need hand sanitizer? Do they need any type of like cleaning supplies? Could they use a gallon of milk from the store? You know, and don't expect anything back in return because times are hard. I mean, you know, if you take, I don't know about other people, but I know for me as a caregiver, if you take the time to ask me, you know, are you getting low on anything? Oh, yeah, you know, I'm out of toilet paper right now. I can't pay you back for it right away, but when some of this stuff settles down, you know, we will take the time to pay you. You know, we will pay you back. It's just be friendly, reach out, come together as a community, check on your elderly, check on people who are at risk, people with, you know, asthma and COPD and, you know, other lung conditions. Just reach out.
Thank you. Thank you, Colleen. I agree 100%. I loved having you on. You are welcome back anytime. Just PM me when you want to, you know, hop on and just, you know, have a chat. It's like I felt like this is a phone conversation, you know. And
I felt the same way.
You know, I just want you to feel welcome to come back anytime to discuss whatever you would like to discuss. And let me tell you, folks, if Colleen and I lived in the same state, we would be a force to be reckoned with.
Sure would.
Because we are like, I used to tell Colleen, we're like sisters separated from birth because we think, you know, a lot alike, and we're very strong women who advocate for our loved ones, and we don't take any crap. And we took a long time to get that way, but we got that way, right, Colleen?
You got that right.
Well, thanks, Colleen. Thank you, everyone, for listening. Please read the blog that Jeannie White writes. Please join these groups. Colleen's group that I mentioned, my group, it will be mentioned in the log. And if you just want to be educated, get educated. Everyone is at risk for being a caregiver. And you may not be now, but you might be in the future. And I suggest you learn now about being a caregiver. I hope everyone stays well, be safe, stay home, please, and shine bright, and just love up on your loved ones and yourself. This is Betsy Wurzel, host of Chatting with Betsy and Passion World Talk Radio. Talk to you soon. Bye-bye.
Oh.